I'm Dr. Farhana Siraj. I'm consultant at the Sher Kashmir Institute of Medical Sciences. Today, our topic for discussion will be hypertension. Hypertension, which we as doctors know, is a silent killer. So, we want to educate the masses about this silent killer. Most of our patients don't know about their hypertension status. As per a census, 63% of the deaths is because of the non-communicable diseases, and 27% of the deaths are due to the cardiovascular disease. Among that, 45% of the people in the age group of 40 to 60 years suffer from hypertension. So it's an important risk factor for the cardiovascular diseases. As I already told you that most of the people are unaware of their hypertension status and they don't get treatment in time. Most of the time they get their blood pressure checked when they feel some giddiness, headache. Otherwise, they don't bother about their hypertension status. Like many of the studies have shown that very few people get treated for this hypertension. 1 among 5 in the male get treated for hypertension, and 1 among 4 of the women get treated for hypertension. There are different stages of hypertension. As per the guidelines, we state one hypertension is where the systolic blood pressure is around 130 to 139 and diastolic blood pressure is 80 to 89. In those cases, we can recommend patients for a non-pharmacological treatment for some time. Around 3 to 6 months, they can observe themselves, they can change their lifestyle, they can have low salt intake. But if it does not get settled within 3 to 6 months, then they need to go for a pharmacological treatment. That means they have to take the drugs. Second is that it has been recently found that metoprolol also reduces the lung inflammation in terms of ARDS, which is associated with the COVID-19 illness. Then systolic blood pressure, if somebody's blood pressure is around, we are able to bring it around 110 to 130. It reduces the cardiovascular adverse events. And it is not only the blood pressure which we see in our offices that is important for the patient. Now, out of office blood pressure measurement concept is very well documented. Like somebody, we can go for ambulatory BP monitoring, we can go for home BP monitoring, we can go for 24-hour BP monitoring, and we can go for the nighttime BP monitoring. It has been found to be associated with the great risks of mortality, and there is a composite outcome of in terms of cardiovascular disease. So it has been found in the studies that if somebody's blood pressure rises by 20 millimeters of mercury in systolic blood pressure and 10 millimeters in diastolic blood pressure, they have a risk of mortality, which is around 23%. And they have a very rise in the CV events also, that is cardiovascular events, by 36%. As such, I want to tell the masses that hypertension is not a disease of days and months. It's a lifelong disease and we need to control it. We need to control it before that any damage happens, because hypertension damages your kidneys, it damages your eyes, it damages your brain. So before that happens, we have to treat it. And hypertension is to be treated lifelong. It needs a treatment as per 2018 European guidelines. And it has been found that better is a combination therapy rather than a single therapy. And for my patients, I just want to concentrate that they need to be adherent to this therapy. As a physician, I just believe that better control in a quick time gives good results. So, in addition to the adherence of the antihypertensives, we need to give a combination of the therapy. And initial drugs, which we have found that they are effective, are ACRBs plus CCBs or diuretics. Then one more point which is to be highlighted is that nighttime blood pressures also needs to be controlled. We concentrate only on the morning blood pressures when the nighttime blood pressures can be high. So initially we can be very aggressive so that our patient's blood pressure gets quickly controlled. So combination of the drugs can help us to quickly achieve our target. Recently, there was a call off for valsartan as it was found. This was one of the antihypertensive drug. This was recently called off because it has a carcinogenic potential. So we need to control this blood pressure at an appropriate time with appropriate drugs, and we need to educate our patients for this deadly disease which can result in the disasters. So it is in the hands of the physician, in the hands of the patient, that they can be well treated in the time. Thank you so much.